Welcome to Focus on Functionality. We hope to provide some helpful insight on one of the most important goals of relapsing MS treatment and show how AVONEX helped newly diagnosed patients stay active over the long term. Let's begin by focusing on 4 types of disease presentations. The first is optic neuritis. Next is brainstem cerebellar syndrome. Third is spinal cord syndrome. And finally, a highly active disease baseline MRI. Now let's hear from each type of patient as she or he describes her or his initial presentation.
My first neurologic episode was optic neuritis, and my symptoms consisted of dull pressure and sharp pain in my left eye. Within a couple days, I had completely lost vision in that eye. Fortunately, I was diagnosed within a few weeks of that first episode, and I began AVONEX treatment soon afterwards.
I remember having double vision. It was pretty scary. I went in for an MRI, and it showed that there were lesions on my brainstem. My neurologist prescribed AVONEX, and I began treatment right away.
I first presented with spinal cord syndrome. In my case, I felt extremely numb and weak in my lower legs. Once my diagnosis was confirmed, I began taking AVONEX a short time later.
I remember having extreme difficulty walking, and that was my first MS symptom. My MRI came back with a high number of brain lesions, and this put me at a higher risk for relapse. And my neurologist prescribed AVONEX.
Results from the 3-year CHAMPS study. In a subgroup analysis of CHAMPS, CDMS risk reduction was measured in 4 different patient presentations. When choosing a course of treatment for your patients with newly diagnosed MS, consider this important fact. Early treatment with AVONEX has been proven to reduce the risk of disease conversion in those who present with optic neuritis and the 3 other higher risk patient types, as seen in CHAMPS study data. AVONEX has been proven to reduce the risk of disease conversion in all of these patient types. These early data help show that AVONEX is an appropriate therapy choice for all newly diagnosed patients, regardless of presentation. Reducing the risk of disease conversion can play an important role in early MS treatment, but another important goal of treatment with a disease-modifying therapy is to delay physical disability progression.